advancing minimally invasive cardiac care through robotic technology for faster recovery and greater precision. Narayana Health City completes 100+ robotic cardiac surgeries in a single month. Advanced robotic technology is enabling surgeons to perform complex heart procedures with unprecedented precision and minimally invasive approaches. 5th March, Bengaluru.
This team of 7 is one of the largest robotic cardiac surgical teams in the country today. The cardiac hospital within the Narayana Health City campus is one of the largest dedicated cardiac programs or hospitals in the country, where we do over 2,000 cardiac interventions and more than 700 cardiac surgeries every month. This is a scale at which drives all of the visions and missions of the organization in terms of being affordable, accessible, and to do work at a high quality for the masses. This organization was set up over 25 years ago. We are celebrating our 25th anniversary this year, and with a vision to ensure that we are advancing medical care, surgical care, to everybody in the country and beyond, to make sure that no one patient is being turned away because we don't have the technology nor the finances available to be able to access high level of quality care in this country itself.
What we did was a tumor inside the heart, which he had a bypass 2 years back in some other hospital with a conventional sternotomy. Now to do it again with a normal one, with the patent grafts, it was difficult for us. So what we did was a robotically assisted this thing. So in this, instead of stopping the heart, if you have to stop the heart, again we have to dissect completely, the heart will get dysfunctional. So what we did was, instead of stopping the heart, we fibrillated, and robotically we could remove the tumor from the heart. So this is one of the first in the world where people have not done without stopping the heart.
So initially we used to take the learning curve is much more in robotic, because it's like a new tool for the surgeon, and it's been included recently in the surgeon's armamentarium. So the learning curve was much more, but now we started doing with much lesser time as comparable to the conventional sternotomy.
And the perfusion and the ITU team, they have got the expertise, and it's all the training process, which is a never-ending thing. We have residents also who get trained, and from outsiders, many people come and watch us, to train themselves, to give this technology to the entire nook and corners of our nation and abroad as well.
It's more simpler to us, so that we get used to the procedure. And now, as Dr. Prabhu told, we have moved on to more like a complex case, which we are doing it regularly and with much ease. And you can ask Dr. Kumar to speak more.
இப்போ வந்து நல்லா ஆக்டிவாக தான் இன்னும் இருக்கேன், நடக்கிறேன். இப்போ வந்து முடிஞ்ச 4வது நாள் இது. இப்போ கூட நான் ஒரு 1/2 hour சேர்ந்த மாதிரி நடந்தேன், காலையில் வாக் பண்ணேன்.
As you can see, I'm the youngest surgeon in the ladder. So the beauty of Narayana Health is that I was trained in Narayana Health in cardiac surgery, and I continued as a consultant. So we've seen the shift of patients initially getting the routine midline sternotomy surgeries, and then what Dr. Nitin said, that Dr. Shetty felt that the future of cardiac surgery lies in going minimally invasive. And over the
robotic instruments are inserted into the chest cavity of the patient. It's not exactly like what the robot does it. Basically, the consult surgeon, the next slide, where the consult surgeon is sitting, he's just actually a few meters away from the patient. So by movement of his arm and legs, he controls the entire robotic arms. And with his movement, it gets translated to the robotic arm here. So you can see the robot arm. Whenever the consult surgeon moves his arm, the robotic arm moves here. Yeah. Now you can see the robotic arm which moves as per the console surgeon who is moving his arms. So basically, like in the next slide, when you see, basically the robotic cardiac surgery or the robotic assisted cardiac surgery just involves 3 or 4 holes in the chest, and through the holes we insert the instruments which are controlled. The robotic cardiac surgery is one of the most advanced technology we have in our healthcare system. And the robot has entered cardiac surgery almost about 2 decades ago, but in the meantime, it has got found out. And now, like in the last almost 8 or 9 years, like the robotic cardiac surgery, robotic has entered the cardiac surgery. So we now, like in the initial phases, like we have been choosing the cases, right cases for the robotic procedures. But as when we keep pushing the boundaries, soon in future, most of the cases we will try and move by robotic system. And to know like which is the ideal patient as of now, like we choose the patients like whose heart function is good and no anatomical challenges, and his vasculature is good. So we choose these 3 patients for the robotic procedures. And as we discussed, like for the robotic system, like for the CABGs, for the coronary artery bypass grafting, where the lungs has to be good, because we do most of these cases in a single lung ventilation. So if they can able to maintain oxygenation with a single lung, yes, we go ahead and do it through robotic system. And other challenges is the vasculatures. There should not be like the peripheral vasculars has to be good. There should not be a calcium burden or atherosclerosis burden on the peripheral vascular system. Yes, those patients we choose for the robotic procedures.
ನಾವು ಮಾಡ್ತಾ ನಮ್ದು ಎಕ್ಸ್ಪರ್ಟೀಸ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸೊ ವಾಟ್ ವಿ ಥಾಟ್ ವಿ ಕುಡಂಟ್ ಡೂ ಬಿಫೋರ್ slowly gradually improve upon what we do. So important ಏನಂತ ಹೇಳಿದ್ರೆ patient safety is very important. ಸೊ ಮುಂಚೆ ನಾವು ಮಾಡ್ತಾ ಇರ್ತಿರ್ಲಿಲ್ಲ, ಈಗ ನಾವು ಮಾಡ್ತಾ ನಮ್ಗೆ ಅರ್ಥ ಆಗುತ್ತೆ ಯಾವ ಪೇಷಂಟ್ ಸೇಫ್ ಆಗಿ ಮಾಡ್ಬೋದು. ಸೊ ಅದೇ ನಾನು ಮೀಟಿಂಗ್ ಅಲ್ಲಿ ಹೇಳಿದಾಗ, ಮುಂಚೆ ನಾವು ಅರೌಂಡ್ 10-15% ಕೇಸಸ್ ಮಾತ್ರ ನಮ್ಮ OT ಲಿಸ್ಟ್ ಅಲ್ಲಿ ಮಿನಿಮಲ್ ಇನ್ವೇಸಿವ್ ರೊಬೋಟಿಕ್ ಮಾಡ್ತಾ ಇದ್ವಿ. ಇವಾಗ ಪೇಷಂಟ್ ಇದು ಸಿಚುವೇಶನ್, ಕಂಡೀಷನ್, ಬ್ಯಾಕ್ ಗ್ರೌಂಡ್ ಅರ್ಥ ಮಾಡ್ಕೊಂಡು ಇವಾಗ almost 50% to 60% of cases are more than that being done minimal invasive and robotic. So and considering the fact that ನಮ್ಮ patient subset ನೋಡಿದ್ರೆ they are bad vessel targets, ಅಂದ್ರೆ ಅವ್ರದ್ದು ರಕ್ತನಾಳಗಳು ಅಷ್ಟು ಚೆನ್ನಾಗಿರಲ್ಲ. ಈಗ ಕಾಕೇಶಿಯನ್ ಅಂದ್ರೆ ಅಮೆರಿಕನ್ ಪೇಷಂಟ್ಸ್ ನೋಡಿದ್ರೆ ಇನ್ನೂ ಅವ್ರಿಗೆ ಬಿಗರ್ ಪೇಷಂಟ್ಸ್ ಬಿಗರ್ ವೆಸಲ್ಸ್. ಸೊ ಆದ್ರೂ ನಾವು ಮಾಡ್ತಾ ಇದ್ದೀವಿ, ಯಾಕಂತ ಹೇಳಿದ್ರೆ ನಾವು ಡೈಲಿ ಮಾಡ್ತಾ ನಮ್ದು ಎಕ್ಸ್ಪರ್ಟೀಸ್ ಜಾಸ್ತಿ ಆಗ್ತದೆ. ಸೊ ದಟ್ ಈಸ್ ವೇರ್ ವಿ ಆರ್ ಗೋಯಿಂಗ್. ದಟ್ ಈಸ್ ವೈ ವಿ ಬಿಲೀವ್ ದಟ್ ಓವರ್ ದ ಕೋರ್ಸ್ ಆಫ್ ಟೈಮ್ ದಿಸ್ ಈಸ್ ಗುಡ್ ಬೆಂಚ್ ಮಾರ್ಕ್. ಪೇಷಂಟ್ಸ್ ಕೇಳ್ತಾರೆ, ಅಂಡ್ ಗುಡ್ ನಂಬರ್ ಆಫ್ ಪರ್ಸೆಂಟೇಜ್ ಆಫ್ ಪೇಷಂಟ್ಸ್ ವಿಲ್ ಬಿ ಎಲಿಜಿಬಲ್ ಫಾರ್ robotic heart surgery.